so now I'm going to demonstrate the arms and hands. So what we're going to do is you might need to apply some more oil onto your hands and just warm it up a few times and rub it into your hands. And you're just going to stroke down both of the arms, so over the shoulders, down both of the arms, and then just give a couple of little squeezes into the palm of the hand. And what this does is it just tells the baby and gives them a cue that you're going to be massaging that arm and kind of asking for their consent if that's okay. And then release the other arm and just holding the hand, just massage using 2 fingers up the inside of the arm to the shoulder, over the shoulder, back down the other arm and over the wrist. And repeat that again. Again, between 5 to 10 times depending on how your baby is and whether they seem like they like it. If at any point they become unsettled, then it's worth stopping, giving them a cuddle, seeing how they respond and trying again, or maybe moving on to a different part of the body. You don't have to massage the whole body all at once. You can pick and choose bits that you prefer to massage each time, because especially a tiny baby won't tolerate more than a few minutes of massage at a time initially, and then they can gradually build on it until they're enjoying it more. So after the stroking comes the squeezing move, so the effleurage and the petrissage. So the squeezing next. So starting at the wrist, you're just going to use fingers and just squeeze up the arms to the shoulder, and with this one you always go up towards the heart. And again 5 to 10 times. And what this does is it squeezes any toxins in the blood into the lymph nodes, which are in the armpits, situated under the armpits, and just helps to flush out their system. So now we're going to do the hands. So what you're going to do is just open out the hands using your thumb or a finger, just circular movements going clockwise into the palm of the hand. This one can be nice to do when they've got their clothes on as well, if they become a bit fractious and it settles them down. And then moving on to the back of the hand, just circles over the back of the hand. And then what we're going to do is move on to the fingers and stroke down each finger from the base to the tip, just slowly stretching out each finger, because with tiny babies particularly, they tend to have their fingers and their hands firmly clenched, so it's nice just to give them all a bit of a stretch. And then what we're going to do is just do some circular movements right the way around the wrist. And this really just helps with flexibility. And in reflexology there's a little pressure point that's just below the little finger, which is supposed to be a relaxation point, so it's just nice just to massage there. If they're ever a bit fractious or a bit unsettled, it might help to calm them down. So then what we're going to do is move on to the next arm. So again, same as before, stroke down both of the arms and applying oil if you need to, squeeze into the palm of the hand and release the other one, and up the inside of the arm, over the shoulder, back down the other side and over the wrist. And again 5 to 10 times depending on how they tolerate it and their age as well. As they start to get bigger, you can start to use more of the whole hand rather than just the fingers if they're bigger. You can give that whole arm a big massage. And then move on to the squeezing. So starting at the wrist, up the arm to the shoulder, and then start back at the wrist again. Always going towards the heart. And then we're just going to open out the hands. And then over the back of the hand, circular movements then to stretch out each finger. And you can repeat that again. And then the little circles around the wrist.